Outside the Premier's meeting, frustration over a lack of access to health care. Inside, frustration over a lack of access to the Prime Minister.
It's past time for the federal government to stop quibbling, to stop saying that we don't have a problem.
Growing anger fueled by this blunt dismissal.
So their 22% figure isn't real.
In a Monday interview with Power and Politics, the Minister of Intergovernmental Affairs accused the premiers of lowballing the federal share of health spending and complaining about a lack of cash while running surpluses or sending rebates to voters.
The federal spending to support public health care is about a third of all the spending. They use this fake figure of 22%.
What's not fake is the fact that the Canadian healthcare system is in crisis.
Newfoundland and Labrador Premier Andrew Furey is also a surgeon who has led international relief missions and still works part-time in a St. John's hospital.
It's not fake when I have to go in and tell a patient they can't have surgery. That's not fake.
If they want to go on a talk show and complain about us, that's fine, but no one will thank them for that.
We indeed want to avoid entering into a sterile debate about numbers.
This time it was the federal health minister on the talk show, saying health ministers needed to do more work before first ministers can meet.
We want to see what type of results we want to achieve together before we speak of the dollars.
We have a diverse group of...
Not the response they wanted after months of waiting.
8 months later, we're exchanging notes through the media. Where'd the love go?
I don't understand why Mr. Trudeau doesn't want to meet us. And it's a bit insulting to send Mr. Leblanc or Mr. Duclos answering our request.
Okay, so David, no meeting, no money. Where does this all go from here?
Yeah, so Andrew, in their private meetings, the premiers are talking about ways they can escalate this fight. And what sources are telling me is that they're planning a national advertising campaign, one that spells out the precise medical and health services that patients could lose if the provinces don't get this money they're looking for from Ottawa. So that federal-provincial unity, Andrew, that we saw during the pandemic, that is clearly starting to unravel, and it's happening fast.
David Cochrane, thank you very much.
Thank you.